Trizzle. I hope you can hear me. I'm Richard Gillespie. I'm an alcoholic. But I haven't had a drink in a little over 14 years. And contrary to what you heard, I'm not a recent graduate. I finished here undergraduate school, pre-med, 55, and have gone on then. So I don't have any slides. I don't have many facts. I have a lot of opinions. And most of them are baloney, because we alcoholics and drug addicts lie. So I hope I'm better about lying now than I used to be, but I still lie. For instance, if I told my doctor, I guess, like most people, how much do you drink? Oh, a couple a night, maybe, doc. My drink was martinis, and some of them were that size. No little nickel martinis. But we lie. Drug addicts, alcoholics, we lie. So I'll tell you my story. And Dr. Trizzles, if I wander and speak too long, he'll blow the whistle. I was born up the road here in Wise County, Cole area. My mother's school teacher. My daddy was a truck merchant back in the hills. They didn't drink. Came down here and went to school. Went to UT, the medical school, then University of Alabama for in Mobile for internship, and Duke. Stayed at Duke, taught for a while. Went into practice in Knoxville, Fort Sanders, anesthesia. And left that after 15 or 16 years, opened a surgery center. In conjunction with it, a pain center. Not like the pain center we first saw this morning. Oh, we did a lot of nerve blocks, pain. And I had a psychologist see all of my, see all of my patients, so kind of keep us on straight. So, and what happened to me? How did I turn into an alcoholic? I don't know. I simply do not know. So I'll tell you how it was. I got to drinking pretty bad, and as time went on and I retired, I got to drinking much, much more, especially on nights, especially on weekends. Married 2 times. First time, 16 years, 2 children. They're 45 and 47 now. My wife told me I drank too much. I thought she was full of baloney. She wasn't. Got married again for 9.5 years, same thing. Told me I drank too much. Other friends did and relatives drank too much. I thought they were wrong. I just kept drinking. And I practiced medicine for 45 years. Anesthesia, pain centers, surgery centers, veterinary hospitals around the country. Pretty controlled sort of fellow. I finally hit bottom. It's kind of when it dawned on me when I go to what used to be called the Disabled Physicians Program. Now it's called Tennessee Medical Foundation. And the gentleman who founded it in Tennessee was a chest surgeon, good man, great man. But when he would talk and tell how drugs and alcohol were affecting physicians, I knew he was talking to me. But I was afraid to admit it because I didn't want to lose my practice. I didn't think that it involved other people. I was wrong. It involved 2 kids, 2 wives, and lots of people around me. It was a horrid situation. Why did I need to drink? Now, I'm not a preacher. It may sound like it in a meeting. I had an empty spot in my life. I didn't have feelings. This is when I sound like a preacher. I disguise feelings, both good ones and bad ones, with martinis and wine and whatever. They're hard to come by. Feelings are. They're hard to admit, especially if, in my case, I could disguise them with alcohol. Now, I know I'm varying a little from the title, the symposium here, but alcohol is a controlled drug. So I got worse and worse. Sort of retired or ran surgery centers, didn't have night call, didn't have weekend call, so I could drink. People would tell me I drank too much. I refused to believe them. But finally, after hearing experts like Dr. Trizzle, thought, those boys may know what they're talking about. This old boy drinks too much. He's hiding everything. He's ruining his life and the life of others. Hit the bottom, kind of a funny bottom. I was at home having dinner by myself. The lady was dating, she was out of town. I had a big old dog, black lab, Henry, weighed about 115 pounds. And I sat at the dinner table, drank a couple of martinis, probably had some wine. My bladder got full, so I needed to empty my bladder. Walked outside to the front porch, got 2 steps, a bunch of boxwood trees beside it. I emptied my bladder and fell into the boxwood. Tore my boxwood all 2 pieces, and I was bloodied and cut up, but I couldn't get up. So Henry came out, and Henry, I'd had him for many, many years. He realized I was in trouble, so he kind of turned around, and I grabbed his tail and pulled me up the 2 steps. I went in the house and passed out in the living room floor. When I woke up next morning, hungover a little bit, it dawned on me, that's probably not normal. There's something amiss when a man has to use a Labrador retriever to retrieve his drunk butt into the living room. Pardon my language. So I called a couple of friends. One was a gynecologist. The other was an endodontist. Good friend of mine. I knew both of them had been into treatment for alcoholism. Went to see them. I said, yep, you need to go someplace for treatment and see if they agree. So I went to Asheville, a place down there that treats a lot of professionals. They said, yeah, you need treatment for 90 days, which I resisted. I said, come on, treat me for 30 days. Nope, we do 90. And I stayed there for 90 days, came back. Now, my life has changed since then. That's what happened to me. That was 14 years ago, and I haven't had a drink in 14 years. And I'm not going to drink today, because I'm going to be here most of the day. Got to drive back to Knoxville. I'm going to get drunk as a skunk tomorrow. I don't know. I've got a disease that's going to last till I'm in the grave. I'm an alcoholic. It does not go away. I can't drink. You all, and lots of people, can may be able to have a glass of wine or a martini. Do fine. That's okay with me. I go to a 12-step program. On a weekly basis, work with drug addicts and alcoholics every day. 6 years in the prison as a volunteer. Prison over here in Morgan County. Tomorrow night I'll be at Peninsula Hospital. So I'm exposed to addicts and alcoholics nearly on a daily basis. And I like doing that. I do it because I want to stay sober, because I want to have feelings now. And I wanted hope when I went into practice that that I could do better. I am doing better. I get along with my kids now. They're 45, 47. My daughter's physician over at Bowman Gray School of Medicine at Wake Forest. Son's in business in Knoxville. I get along because I sat down and talked to them and apologized for the crappy way I had treated them when they grew up. And now we're honest with each other. And we've got to, if there's something they want to tell me and it kind of hurts my feeling, or I want to tell them, we're honest. We share it now. So I get along with my kids pretty good. Got 3 grandchildren, 2 little boys, and 1 granddaughter. They've never seen Granddaddy drunk. Hope they won't. This is a horrible disease. Horrible disease. And in the people I talk to, what's the difference in the alcohol and drugs? I don't know. There is some difference, I'm sure, and there's some difference in the chemicals, but I don't know. So my life has changed. Now, when I was in medical school, I had 1 hour of addiction lecture. 1 hour. But that was 1960. My daughter's been out of medical school about 15 years. She had 1 hour. I hope y'all get a little more, and if the dean will get on me because he says it's hard to design this curriculum and find room for everything. But it's an important thing that as you have been here. Who's responsible for this stuff? Doctors, are we responsible? You mighty right. We share some of it. Drug companies, are they responsible? You mighty right. They will share some of it. Poverty, yep. But we got to do it with the practical problems. If you've been in practice a year, and a lady who's 45 comes in and said, Doc, what do you think? Johnny, her 15-year-old son, is spending a lot of time in his room. His friends have changed. His grades have bottomed out. Does he have a problem? You mighty right. He's a drug addict. You can bet on him. Or the man who's 45 comes in after you've been in, in practice a year or 2, and he said, Doc, I don't know, what do you think? I come home and my wife is slurring her words. She's a little forgetful, and I see in the trash some empty vodka bottles. What should I do? Does she have a problem? What should I do? Indeed, she has a problem. She's an alcoholic. But we've said this young man's a drug addict. This man's wife is an alcoholic. What are you going to do as a doctor? They've come to you or me for help. What are you going to do? That's a dilemma. Just heard it. What are you going to do? There are plenty of programs. Now, there may not be as plentiful right here in this 3-county area just because of population as there are in Knoxville. But you can, I can be in Knoxville in an hour and 20 minutes. Or right here is a man that'll help. Okay, thank you. You can get they can get to the treatment areas. There's a funny old disease. And I'm about through here because I think it's a disease that I have, and maybe some other people, kept in the closet. We don't want to tell people we're alcoholics or addicts, drug addicts. Much like we're starting to get it out of the closet now. Much like the discussion of sex, we're getting out of the closets. Homosexuality, we're getting out of the closets. Sex change operations, things like that. If we can get this thing out of the closet, because it's knocking us in the head. It is. You just heard it. It's knocking us in the head. It's killing us. Now, which is worse too, and I'll finish. Is alcoholism responsible for more deaths than drugs, opioids? The answer is, you mighty right. Many, many, many more. The trouble is, you don't see death certificates that say alcoholism. The last one I saw was my son-in-law, who was 45. He was about as big as your arm, and the only thing left in his apartment when the coroner came out of anything to eat or drink was vodka. Died, 45. But the coroner did write on there, cause of death, alcoholism. And now I don't see many death reports because I've been retired for a long time, but we hide that too. It's usually, you know, cirrhosis or esophageal varices or something other like that. But so what do we do? If you want to have a drink, that's fine. I can't drink. I cannot drink because one tastes like two, tastes like three. I got a disease. It's kind of like diabetes type 2, or even worse, it's like kudzu. You can cut kudzu back and you can lay back kudzu and you can lay back my alcoholism, but I'll be damned if it won't rear its head in another few days. It won't happen. So be aware of it. Help us help you. If you need help, get some help. Ask people about it. Dr. Trizzle said it. Ask people about it. How much do you drink? A martini or two? What other drugs do you take? Do you want some help? We'll get you some help. We can. We'll get you some hope. And there is hope in these addictive disorders. I think, has been for me. I live a good life now. I live a really good life now. Get along with the kids. I'm better with relationships. I was poor with relationships. Not worth a two. I'm not great now, but I'm a little better. And so I'm sliding into old age. I'm 84. A little more gracefully than I would have done with alcohol. And it's I guess a binary decision for me. What would my life be best like in the future with alcohol or without alcohol? And it's a simple choice for me now. My life will be better in the future if I don't have alcohol. Thank y'all.